Welcome back to Indiana Newsdesk. The coronavirus is putting a strain on healthcare systems everywhere as COVID-19 spreads and hospitals around the world request more life-saving equipment. Medical device companies such as Bloomington-based Cook Medical are hurrying to meet demand. Reporter Mitch Legan spoke with Cook Group President Pete Yonkman over a Zoom video call to see what the company is doing to help combat the coronavirus.
More generally, how has this coronavirus, how has it impacted Cook the last couple of months?
We've been following this since early December of last year. We've been able to maintain our supply chain. One of the things that's really important, and sometimes people forget, is that people focus on hospitals a lot, and of course that's extremely important, but they can't do their job if they don't have the tools. And so what we do is make the tools for physicians and people who are on the front lines of this battle. And so we've really worked very hard to make sure that we maintain our manufacturing and distribution capabilities, because if we can't get our products to hospitals, patients can't be treated.
I saw last night that I think it was the GM plant in Kokomo had said that they would take a look at possibly creating ventilators or anything like that. My question for you is, kind of along the same lines. Do you have the ability to, switch production to things like ventilators or stuff like that?
So we probably are not equipped to make something like a ventilator. That's a very complex machine, very complex supply chain. There are probably better who are better situated to do that. But there are some unique capabilities and resources and skills that we have as a company that nobody else does. For example, we're looking at a program with IU Health and looking to see, can we use our sterilization capabilities to be able to take masks, the N95 masks that have been used, or surgical masks, and re-sterilize them so they can be used again, because there's been a lot of shortage of these masks. But one of our core functions and our core capabilities is doing sterilization of products, as you can imagine, because our products need to go into a sterile environment.
What would that look like if you end up going with the mask sterilization sort of thing? And what would it look like, and when would that start?
So just to give you an example of how quickly this thing is moving, we went from the idea of could we re-sterilize masks to testing them and to putting in place a procedure in less than 24 hours. In a normal time, that might take more than a year. But our teams are moving so quickly in coordination with IU Health. Now, we're still in testing. We don't know exactly if this is going to work or not. But if it does, it will allow the healthcare system to greatly extend their use of masks and protective devices. So we think that's a great match of our skills and then the need in the community in a way that we can help give back for the people who are trying to provide care on the front lines.
Governor Holcomb comes out with this shelter-in-place order. How will this shelter-in-place order affect Cook, specifically in Indiana?
More than half of our global workforce is here in Indiana. And so the ability for us to deliver products to patients across the world depends on the people here in Indiana. So we have what we've done is we've taken a critical look at our infrastructure and said, there are certain aspects that we need to maintain for sure. That includes manufacturing and distribution, because we ship out from Indiana to all over the world. So we want to make sure that stays intact and is robust. So anybody who has been who is at a facility where one of those functions takes place, manufacturing, distribution, we've asked anybody who is not critical to that function to work from home.
Are you changing any policies, to make sure that your workers can make it financially during this uncertain time?
So we've done things like having people work from home if they can, and that has been going surprisingly well. Better than we had expected it to go. The other thing we're doing is making sure that for those people who really are critical to making products, we want to make sure our environment is as safe as it can be. And then what we're trying to do is identify policies that help people figure out how to adjust their schedule. So we put in place almost a 24/7 schedule that allow people to pick shifts depending on what their needs are for childcare or for caregiving in some way. So we're really trying to be as flexible as we can.
Yonkman says Cook has been able to maintain its supply chain and is operating at about 95 to 97% capacity in terms of its ability to do business. He says there haven't been any disruptions so far, but things could get more difficult as more places enact different restrictions, quarantines, and shutdowns.